Hey, thank you all for coming to the talk tonight. I'm going to be talking a little bit about our program, Mount Sinai, which is in the heart of New York City, and our whole residency training program. We're really excited to tell you guys all about it today. So we'll start off with our mission statement. I'm not going to read everything right off the slide, but really Mount Sinai and our program are really dedicated to really creating a really good physician in terms of the areas of knowledge acquisition and application, skill development, clinical judgment, team leadership, and interpersonal communication. We work in the middle of New York City, which is one of the most diverse populations in the country. And we're really committed to producing well-rounded, passionate, culturally sensitive, and dedicated physiatrists. So a little bit about our program. We are ACGME accredited. We are the largest completely categorical program in New York City. We now just expanded our program. We were about 8 per year, but now we're going to moving forward to 10 per year. So I'll talk a little bit about the PGY 1 year. So really it's 13 months total. You'll be pretty much ingrained into the internal medicine program for the most part. So everything follows a 2-week block pattern, and you have 4 weeks of vacation. And in terms of sick call, we basically only cover ourselves, us, the PM&R residents, even though we're mixed in with medicine and neuro and all those other programs, we will only cover us on medicine, and not on our other rotations. So really, in terms of locations for where we rotate, in terms of internal medicine, it's kind of a mix of days and nights, about, 6 weeks to 8 weeks of nights. There's 2 weeks in the ICU, just the MICU, and then the rest is split between Mount Sinai, Elmhurst, and the VA. We also go to Union Square for emergency medicine, which is more in an urgent care setting for about a month. But we have, we also go to neurology for about 2 to 2.5 months. We get a mix of stroke floors, inpatient consults, movement disorders clinic, as well as peds neurology. And then we have our outpatient clinics, which the rest of the months are basically PM&R. We have basically 2 months of pain and sports, and it's a mix ortho sports. So you get some orthopedics, you get sports medicine, interventional sports, as well as interventional pain as well in the first year. We also have a consults service here at our hospital, where we're assisting all on the acute side of medicine, which is a pretty new for us. We'll get more into it, but yeah, you spend about a month on that too, and it's a really different experience. And then we do a month at Mount Sinai West, which is really where we do a lot of general rehab. There's some stroke rehab, but it's really a lot of orthopedic rehab as well.
Hey everyone, I'm Eliza. I'm a PGY3 at Mount Sinai. I'm going to talk about what happens during PGY 2, 3, and 4 years. So we have 13 months per year, and each block is 1 month, so 4 weeks. We have 24-hour call as a PGY 2 and 3. It's usually once a week, and that's at the main hospital where we do our spinal cord injury and brain injury. And then after the 24-hour shift, you do get a post-call day. For our location at Elmhurst, that is home call. However, you do have to go in on the weekends to round on the patients, usually for a couple hours on Saturday and Sunday. And then you have to see 8 consults during the weekend. At the Bronx VA, we don't take call. And then we get 4 weeks of vacation each year. And on the right, you can see a chart of all our locations, what rotations we do there, and for how many months. I'll just briefly go over it. At Mount Sinai, Maine, we do spinal cord injury and brain injury. That's about 5 to 6 months during all your years of residency. So during PGY 2, 3, and 4, that is how many months you do total. And then at Mount Sinai, Maine, we also do consults. I do want to note that our inpatient rehab unit is moving. So right now, although we're at the main hospital for spinal cord and brain injury, we are moving to Mount Sinai Morningside. So by the time the new applicants come and we have new PGY ones, our inpatient unit will be at Morningside. And then we also have outpatient clinics for 4 months. We have Elmhurst and Mount Sinai West, where we do general rehab for about 1 to 2 months. We have Elmhurst, where we do EMG for 4 months throughout your entire residency. We also have pediatrics and outpatient clinics at Elmhurst, as well as consults. And then at the VA is where we do our EMG for 2 months. And then we also get pain, acupuncture, and outpatient clinics. And during your time at Sinai, you get 4 months of electives. So again, just to reiterate all the locations that our program goes to, we go to Mount Sinai Hospital. That's the Mount Sinai main right now. We go to Mount Sinai Morningside, which is where our inpatient unit will be moving to, where you guys will do spinal cord injury and brain injury. And then we also go to Mount Sinai West. We go to Elmhurst Hospital. We go to the Bronx VA, and then we have a couple of outpatient clinics. We have the outpatient clinics at 5 East 98th Street, East 102nd. Those two are by the main hospital in the Upper East Side. And then we have Mount Sinai Union Square, which is in Union Square, and 2875 Broadway, which is on the Upper West Side.
Hey everybody, I'm Dan. I'm also one of the PGY3s here. So I'm gonna talk a bit about like the benefits and stuff like that. Um, so we do have a housing lottery that's available at Mount Sinai that you basically sign up for before starting intern year, and you basically can get paired up with subsidized housing in the city, majority of which is up here in the Upper East Side, but there are a few other spots throughout Manhattan as well. We have a meal stipend of $13.50 a year, which is usable at every Mount Sinai site that has a cafeteria, as well as like the Starbucks that are available in the hospital as well. And I will say the food is pretty good at Mount Sinai, so that is one kind of plus as well. We also have GME and departmental funding that kind of varies by PGY year. Some of it is kind of consistent throughout every year, but then some of the other ones kind of go up each year. In the past, these have been used to cover things like conferences, STEP and Comlex, board prep, and people have also used it to kind of like replace their like laptop, for example. So these funds are pretty flexible, thankfully. We also have shuttles that go to all of the sites that we rotate at, so like Elmhurst and the VA. And then for those people who can't make the shuttle because they don't like live near any of the shuttle sites or they like miss a shuttle, for example, the subway and the buses are also very, very convenient and go to every location that we go to. So it's very helpful. And at the bottom, we just kind of have the most recent salaries that we're getting paid this year. And we recently got a raise as well. So that's kind of reflected in these numbers. So that's kind of from what PGY 1 to PGY 4, as well as PGY 5s would be the fellows at Mount Sinai. And then going into education, so we basically have like 4 hours of dedicated didactics every Tuesday from 8 a.m. to noon. This kind of varies week by week, but typically it's in person, but we also do have a few virtual sessions as well. Generally speaking, these tends to be like lectures about PM&R, whether it's like TBI, SCI, sports, etc. But we do have a lot of hands-on sessions as well that kind of replace like the traditional like lecture style present didactics. That includes things like ultrasound practice, which is through the ultrasound curriculum that we have here. It includes like a cadaver course, an anatomy dissection, as well as like injection practice. So we do a lot of hands-on things during didactics as well, which is really awesome. We also have journal clubs while on TBI and SCI, and then also at Elmhurst. So those are super cool ways to kind of stay involved with like any current research that's going on. And then also of note, while on spinal cord injury, you do have a few like special rounds that includes urology rounds to kind of help any patients who have issues like neurogenic bladder. We also have neurosurgery rounds, which is super awesome. It's led by two neurosurgeons at Mount Sinai who essentially go over imaging of the spine and the brain with us to kind of discuss like various pathologies and kind of help like orient us to like specific like neuroanatomy and how to kind of like look at scans the best way. And it's super helpful. And we also have wound care rounds. So we basically just kind of learn about wound care management as well. So that also happens on SCI. We also have like a bunch of opportunities for research if that is something that you're interested in. We do have a research track, and that essentially is for somebody who is more interested in really delving into research and really having like big projects. So there's a lot of opportunities for that. We all are also a TBI and SCI model system, and as a result of that, we do have a lot of connections to like really interesting patients as well as like interesting research projects. A lot of that is through the Abilities Research Center. So if you're really interested in neuro rehab and research, the Abilities Research Center is like a great potential like opportunity for like getting some more research experience. We also have sports coverage opportunities kind of throughout all 4 years. You could start as an intern, and at the picture at the bottom left, you could actually see two of our chiefs and one of our sports fellows doing sideline coverage. There's a lot of different ones like boxing, soccer, baseball, etc. So it's also again a super great way to get early on sports experience before starting fellowship. Um, we also have this clinic called EHOP. It's one Saturday every 6 to 8 weeks. It's basically a free clinic for uninsured patients, and it's also a great way to get some hands-on experience with Botox injections and knee injections and things like that. And then lastly, we do get a lot of key like PM&R resources, and we do get our memberships paid for APM&R and AAP. So lots of great bonuses.
Hi everyone, I'm Sam. I'm one of the PGY2 residents. Really excited to talk to you guys tonight. So, as we've mentioned, we are currently in the process of moving over to our brand new unit over at Morningside. It's up like in the Columbia area, if you're familiar with it at all. There's going to be about 50 patient beds divided between TBI and SCI services. There's multiple like ADL rooms, conference rooms, and it's really a beautiful new unit. We're really excited to move over there. Here's some pictures of the gym and all of this new conference and ADL space that we're going to have. Something that we're particularly excited about is this unit was built in mind to be a rehab unit. So there's like lifts integrated into like the build out. So it's really going to be functional for our patients and helping them during their like SCI and TBI recoveries. So here you can see some of the key individuals who play a big part in our program. I'll just highlight a few. On the top left, you see Dr. Herrera. He's one of the sports and pain attendings, but he's also our department chair. And then as you move over the top row, second from the right, you'll see Dr. Escalon, who I think many of you are probably familiar with. He's our PD. He is like both SCI and TBI trained technically. So he'll cover the floors a lot. You also work with him in clinic, and he's really a wonderful resource. We meet with him periodically throughout the year, even as interns, just to discuss like career goals, things that we should be considering and working toward those goals. So he's really involved with us all the way through the program. Next to Dr. Escalon, you'll see Dr. Trentman. She's one of the new APDs. Notably, she was a resident at Sinai, a chief at Sinai, and then came on. She's one of the generalists. She's really lovely and wonderful to work with. And then you'll see in the middle, Dr. Riccobono. So Dr. Riccobono is one of the neuropsychologists who works with the patients, but she also is really a fighter for like resident wellness and well-being. She plays a role in helping us to communicate with the program, make changes, and implement things that we feel will make the program better for us and for future residents. We really feel very privileged to have her and to be able to work with her while she's here and while we're here. Next to Dr. Riccobono, you'll see Dr. Zachary. She's the sports PD. So if you're interested in sports, she's a good person to know. And then next to Dr. Zachary, you'll see Dr. Cruz, who's also one of our APDs. She's a sports and interventional spine attending. She was also trained here. Also, everybody is very nice, super excited to teach, and really wonderful people to learn and work with.
All right. Hi guys, I'm Lucy. I'm one of the PGY2s. This slide is really just to emphasize that Mount Sinai really does create leaders. This list shows a lot of people that went through our residency program and are now leaders in PM&R across the nation. Just to point out a couple of people, this is Dr. Ross Afonte, he's the current chair at Spalding PM&R. Then Dr. Stephen Flanagan, the chair at NYU PM&R. We have Dr. Adam Stein, he's the chair at Northwell PM&R. Dr. Stephen Kirschblum, the chair at Rutgers PM&R. So you can see a theme here. There's a lot of chairs, a lot of leadership. And then also just to highlight some people that are currently with us, we kind of talked about Dr. Zachary already. She is the Sports Fellowship PD, but she is also the medical advisor for the USA fencing team. And then we have Dr. Richard Chang. He's one of our sports attendings, and he's also the outgoing New York Society of PM&R president. And then this slide really just shows the fellowships that have been obtained by our residents in the last 10 years. You can see that there's a variety of fellowships within sports, pain, interventional spine, brain injury, spinal cord injury, and even more niche specialties like neurocritical care and palliative medicine, which just kind of highlights that our program really prepares you well for a variety of things, very well-rounded, and you can get where you want to be.
This is basically a slide that's just kind of showing that the abilities kind of research lab that we already sort of touched on. But for the sake of time, the whole point here is that we do have an awesome resource with Dr. Putrino, who's a PhD, and I think also don't quote me on this, but at least he has a very strong fund of knowledge in physical therapy. So he's very well renowned. There's a lot of opportunities at the ARC, is what we call it, and a lot of good things for movement disorders, spinal cord injury, and brain injury. And then this one was a pretty cool experience, actually, to sort of at least see in firsthand in some sense. But these guys that you see here in the this movie, Quad Gods, is basically kind of what it reads here is SCI patients that were in the acute rehab at Sinai. They formed a quadriplegic esports team. And the great thing about this film was to demonstrate how technology can basically empower individuals with disabilities. So it's a very good movie. I think we're very prideful about this. And we see these guys in our unit, and they're an awesome resource for patients with spinal cord injuries. And then just a fun picture. We do a lot of activities together. One of the biggest highlights this past summer was a resident retreat at the bottom left. Tons of fun upstate. We also have kind of this run club, also a hiking club too that we just started, poker club too, I guess, and just you know, whatever little events here and there. And that is pretty much it. This slide, you can reach out to Dee, who's our coordinator. You can follow us on IG if not already, and just kind of see what we're doing day to day. Adam, who's our co-resident, is always posting whatever we're up to. So encourage you guys to check that out if you're interested in kind of learning more about the culture.
Also, I've tried to keep up with the chat. I know a couple of us are, but if we missed anything, please just say it now. Ask any questions you have.
We have about 2 minutes for questions, so if you have any questions, yeah, just let the residents know.
I'll put my email in the chat as well if you'd like to reach out. I'm happy to answer questions via email.
Okay, I guess this is probably the last question for today because we're almost out of time. But Francesca asked, what favorite thing to do in New York City when not doing great rehab work?
Eat a lot of food.
Going to Brooklyn.
Walking in Central Park.
All of the above.
Going to
I was
every
just gonna
concert
say, you stole
possible.
mine, Eliza.
Okay, I think that's about it. Thank you so much, everyone, for joining for joining us tonight. I know you guys have a very busy schedule, but taking time out of your busy lives to tell us about your program really means a lot. So thank you so much.